Hi there, this is Dr. Gordon Cameron from bloodpressurehigh.com with a reply to one of our readers' questions about low blood pressure and infection. The question described how someone with a viral infection, a fever and a sore throat went on to develop problems with fatigue and low blood pressure. The low blood pressure seemed to persist for several weeks even after the viral symptoms had responded and recovered. This is actually, in my experience, quite a common situation, and usually it's nothing to worry about, although if the problems persist for more than about 2 weeks, then it's worth seeing your family doctor just to have some blood tests done. These bloods would normally check for anemia and to make sure that the immune system is working properly and efficiently. Although low blood pressure is fairly common in the context of a short-lived viral or mild bacterial infection, it can also happen in the presence of a much more serious septic or septicemia infection, where the overwhelming infection throughout the bloodstream causes the body's system almost to collapse. This is a very different clinical picture and it needs intensive care support for most people, and it can sometimes in fact lead to life-threatening situations and problems. So in answer to the question, yes, low blood pressure is fairly common after a short-lived viral infection. It typically resolves itself without any particular treatment. If it goes on for longer than a week or so, then it's worth having some blood checks done by your doctor. But as always, if in doubt, arrange to see a doctor or a nurse and have a thorough check over if you have any concerns. Thanks for watching. You can get much more about this sort of stuff and the chance to ask your own questions over at bloodpressurehigh.com. Thank you.